Well, thanks for staying with us tonight. President Cyril Ramaphosa says the latest figures in terms of COVID-19 suggest the country has largely passed the third wave of infections, although some areas do remain a concern. The National Institute for Communicable Diseases reported 9,718 new daily infections in the country on Sunday. This increase represents a 26.6% positivity rate. Well, joining us tonight is COVID-19 Ministerial Advisory Committee member and Right to Care CEO, Professor Sanne. Professor Sanne, good evening to you, and thanks for your time. So, given the fact that...
I said good evening, Kathy. Sorry.
Sure. Thank you so much for coming on to the show tonight. Given the fact that the plan, in as far as the rollout of vaccines is concerned, has not really gone according to what government had initially been working off, as the Ministerial Advisory Committee, what are the targets within which you are working right now, and what are you looking to achieve?
So Kathy, I think we should start out by reminding viewers that indeed I'm on the COVID MAC, which is the treatment MAC. So I'm not a vaccine MAC member.
Okay.
But I'm fully aware of the targets and the work plans because of the engagement that Right to Care has with the National Department of Health to assist to grow the program. And indeed, if we look at the biggest constraint up until now has been vaccine supply. And now that the larger volumes of vaccines are becoming available, the ramp up is moving forward very rapidly. So the program up until now, given the supply on hand, has been ranging every week somewhere between 95 and 110% of the target. So the program is working. The expansion of the sites has been substantive. And we'll notice that if you go back in the last week, that indeed there was over 240,000 vaccinations performed every day. And that is a remarkable achievement. My understanding is that as the number of additional sites are formed and opened, and with the additional vaccine supply, that it is completely conceivable to me that we will reach 400,000 vaccinations per day on as soon as in 2 weeks' time, and that indeed this can continue to rise. There is almost no hesitancy. So, there's lots of noise from people who wish to portray anti-vax vaccine ideas. But we have projects running in remote, deep rural areas of South Africa, such as the Sasape Point project, where it's more about bringing vaccine to the people and making it accessible than it is about vaccine hesitancy. So we saw none hesitancy in the project in the Eastern Cape, deep rural project, in the last couple of weeks. And so, in fact, we have a community that understands this, that understands the severity of illness, and we have a rapidly ramping up vaccine program. Today, or last night, the President also announced that indeed the eligible population, 35 to 50, is registering at a remarkable rate, and that we anticipate to have a large proportion of those individuals vaccinated by the end of August to enable the age group 18 to 35 to open up. There were a number of special essential worker populations that were brought ahead, and they are being vaccinated with Johnson & Johnson vaccine that had a short-dated supply, but indeed we're well on track to use that before the expiry date of the 11th of August.
You talk about the fact that there isn't much hesitancy, and yet when we look at the take-up of the vaccinations, even perhaps in the older parts of the populations, that didn't happen at the rate and the scale that government had anticipated. And just this past weekend, we've had a number of protests take place in different parts of the company. I saw some in Cape Town, saw some in Johannesburg, and people who are basically anti-vaccinations. How does government and perhaps even yourselves as members of the Ministerial Advisory Committee plan to ensure that that education is reaching all parts of our society, whether it's in suburbia or even in the rural parts of the country?
So in terms of vaccine delivery, it is as much about having access to vaccine as it is efficient service delivery. A number of key moves have been made in the recent time to ensure that we deliver a wider, more broad vaccine program, and those include opening up private sector sites to vaccinate public sector patients, and the reimbursement model has been announced, makes it quite feasible for private providers to in fact vaccinate public patients. There are some remarkable achievements. So, for example, Limpopo province, with a mobile moving vaccine campaign, has reached over 70% of the population above the age of 60. And so, indeed, that's public vaccination. Private, the biggest achievement is probably over-serviced by a number of large vaccination sites, but indeed the Gauteng private component has achieved 90% vaccination rates in the age group over 60. Now they are open to receiving public sector patients. My sense is that there are three kinds of people. They're the people who were fast adopters, and they have been vaccinated and will come forward as each age group comes forward. Then there are the anti-vaxxers, and no matter how much you wish to educate, they're going to be determined to not vaccinate. And the concern there is that they will drive the infection rates and hospitalizations into the future. And we've seen that in the US, the expanding pandemic with Delta virus is in fact hitting the unvaccinated the hardest. And then there's the group in between. And we need to target our communication in a tiered strategy from key opinion leader through media education, as we're doing at present, to peer support groups. My biggest, strongest message there is, how about every one of us who believe that vaccines work and potentially have been vaccinated, as I have, make sure that our neighbors, our grandmothers, our aunts, and perhaps the person just down the road or at church, that they have been able to register, understand how to get the vaccine, and have their questions answered. The amount of information out there is enormous. And so I think it's the responsibility of every citizen to, in fact, make an effort to include their surroundings, become advocates, and not only advocates, but actually take action and take the granny from church to the vaccination site as your social contribution for this coming month.
Do you believe that we are out of the woods in as far as the third wave of the pandemic is concerned?
So this is a MAC advisory that we did all participate in, and the transmission rates have dropped below 1, which means that it is a constricting epidemic at this time. And we remain concerned, and on the watch list is the Western Cape. We remain concerned that the Northern Cape is not coming out of the second wave. They've actually had high rates for a number of months now. And we are very worried post the riots in KZN that we may see an explosion of COVID in KZN. But the overall sense was that the case rates are coming down. It does not mean that the hospitalization rates have come down as yet. The pressure is still high on the health system. And although we always say that the lockdown is intended to reduce the pressure on the health system, I'd really like to emphasize that it is also to protect people from becoming severely ill and not being able to find a bed, because we know that if case rates are very high, that indeed the mortality rates of hospitalized patients also rises rapidly, as there's just not enough personnel, not enough beds, and people may in fact be coming to hospital too late. So overall, we made the advice to reduce to level 3, but we would like to strongly emphasize that this can only go hand in hand with rational and really important continued masking, social distancing, and the overall preventative behavior that we've all come to know that will ensure that the case rates don't climb again. The MAC would have no hesitancy that if the case rates reverse, to make the recommendation again to raise lockdown levels.
Professor Ian Sanne from the Ministerial Advisory Committee on COVID-19, thanks for your time on News at Prime tonight. It's just gone.